What if I told you that surviving surgery 800 years ago was more about luck than skill? Imagine yourself strapped to a table with nothing but a sharp knife in the hands of a complete stranger. No anesthesia, no sterile environment, just intense pain and the constant threat of death. How would you feel if you knew that a simple cut could lead to a fatal infection, or worse, the loss of a limb? Would you survive medieval surgery? We're going to dive into the brutal reality that no history book ever truly showed. The savage and shocking practices that defined surgery in the Middle Ages. Are you ready to face the terrifying truth of how people survived, or didn't, medieval operations? Brace yourself, because what you're about to learn will change the way you think about the history of medicine. Picture yourself transported back to the 14th century. The sound of wind rattling against the windows of a dark house. The smell of raw flesh and dried herbs mixed with the fear of the unknown. You're lying on a simple wooden table, a sharp blade glinting before you, and the only thing stopping it from cutting your skin is the chilling realization, without anesthesia, you'll feel every inch of the pain. There's no escaping what's about to happen, no turning back. These were the horrors of medieval surgery, where the concept of healing was an act of courage, both for the operator and for the patient undergoing the procedure. Unlike today, where we can rely on well-trained professionals, cutting-edge technology, and post-operative care, patients in the Middle Ages had to rely more on their luck than on any medical skill. If someone was fortunate enough to survive surgery, it was either because the patient had an immune system strong enough to resist infection, or because local astrologers and healers had offered a miraculous prayer. The absence of anesthesia was just the beginning of a host of problems. Imagine the scene: a man undergoing surgery to remove a limb, without the blessing of morphine or even a simple pain reliever. He would be tied to a crude table, hands and feet immobilized, while the medieval surgeon, typically a barber surgeon, used a saw or a sharp knife to cut through muscle, bone, and sinew, and all of this without any form of pain relief. The only comfort the patient could expect was alcohol, which served more to numb the mind than to alleviate physical pain. Life expectancy after surgery. The likelihood of survival largely depended on the patient's luck, how they reacted to the pain, and especially their ability to avoid the infections that followed. If luck was on their side, the patient might survive the intense pain of the operation, but complications were almost inevitable. Infection was the leading cause of death after medieval surgery. The concept of sterilization, or clean environments, simply didn't exist. There were no antibiotics to cure or prevent infections, and surgical tools were rarely cleaned properly. Imagine for a moment the chances of surviving a leg amputation with a dirty saw, without a single drop of boiling water to wash the wound or clean the instruments used. And if the patient was lucky enough to avoid the initial infection, they still had to face the dangers of hemorrhage. After a deep cut, blood loss could be fatal, but techniques for stopping the bleeding were rudimentary. Cautery, burning the flesh to seal the wound, might be used, but this meant intense pain, not to mention the risk of the cautery not working correctly and the patient losing more blood or developing even more severe complications. Those who dared to perform surgeries in the Middle Ages were not professional doctors or specialists like we have today. Barber surgeons, a class without formal training, were frequently called upon to operate. These figures, who combined the roles of barbers and dentists with that of surgeons, had few tools and limited knowledge of the human body, which was often based on superstitions and spiritual beliefs. Meanwhile, folk medicine believed in healing through supernatural forces, and often, patients hoped for miracles or divine intervention to survive surgery. They surrendered to faith, relying on healers who mixed treatments with prayers and rituals, believing that a miraculous cure was possible, even when scientific methods were practically non-existent. Throughout the centuries, healing through luck was a constant. It was a matter of life or death, where many paid the price for a lack of knowledge with their own lives. And what made things even more terrifying was the uncertainty. The chance of not surviving depended not only on the surgeon's skill, but also on the patient's mental fortitude and will to live. At that time, many people underwent these surgeries out of necessity, not choice. If you were a warrior, for example, in a bloody battle, a severe injury meant that surgery was the only option, even if it was risky. Even peasants, who barely had enough to eat, often found themselves forced to rely on lucky surgeons or a surgeon's luck. For many of these people, an operation might be the only path to survival. But what would their life be like afterward? The physical and emotional scars were deep. But perhaps the greatest tragedy of medieval surgery wasn't the pain, nor even death. Perhaps it was the injustice, the fact that many patients had no alternatives. If you had a severe infection, cancer, or even an injury requiring surgery, your life was in the hands of a system that didn't know how to efficiently heal or alleviate suffering. The lack of options for the poor and the lack of medical education made survival almost impossible. You, as a medieval patient, would have been just a number in an experiment in pain, where healing was more a matter of miracle than skill. And the innocents who didn't survive, their stories are lost to history, while the few who lived to tell their tales are remembered as witnesses to a brutal and inhumane era. You are in a small medieval village, perhaps in the countryside, perhaps in a walled city full of mysteries. There are no hospitals, as we know them today, no clean rooms, no precision equipment. What existed were makeshift rooms, where surgeries were performed with rudimentary tools, often in people's own homes, sometimes even in the middle of the street. The concept of a controlled environment or minimal hygiene did not exist. Instead, what you would have was a crude wooden table with dim light, perhaps a faint candle, and a surgeon who often barely knew what they were doing. They would use the simplest instruments, such as blacksmith's knives and saws, to cut, tear, or amputate. No sterilization, no gloves, just sweaty, dirty tools from so many previous operations, with dried blood and pus still clinging to them. The concept of cross-contamination wasn't even imagined. In some towns, barbers not only cut hair, but were also called upon to perform operations, such as tooth extractions, amputations, or even cataract removals. They were known as barber surgeons and had limited training, but enough to venture into a life-or-death task. In a typical medieval surgery scenario, you would lie on the table, nervous, with the physician or surgeon preparing the instruments before you. The expectation of surviving the surgery was minimal, and the fear of infection was omnipresent. When blood began to gush, there was no way to staunch the flow cleanly or effectively. There were no antiseptics or adequate dressings. After surgery, if you were lucky enough to survive the shock and pain, it was more than likely that an infection would set in. These operations, which could be amputations, trepanations drilling into the skull, or even tooth extractions, were performed without minimal post-operative care. The patient remained vulnerable, and any small cut, not treated correctly, could result in gangrene and death. But, incredibly, people didn't have many alternatives. Death often seemed a closer solution than a cure. Even if the surgery was technically successful, patients faced a harsh reality. They needed to heal without antibiotics, in unsanitary environments. There were no modern dressings, and suturing techniques were primitive. Doctors used suture threads made from animal sinews or hair, if they were lucky enough to have these materials available. Open wounds were an invitation to infection. Untreated infections could quickly lead the patient to a state of septicemia, where organs began to fail due to poison spreading through the bloodstream. And without antibiotics, the outcome was often fatal. And if you asked yourself, what if I were rich? Would there be better treatment? The answer, unfortunately, is that the wealthy were also subject to the same brutality. Although they had access to more experienced surgeons and even the intervention of healers, this didn't guarantee better results. The lack of scientific understanding of the human body and the lack of control over infections affected all levels of society. Therefore, even in a royal court, where wealth might allow for more refined techniques, the chance of dying after surgery was extremely high. In the case of more complex surgeries, such as war surgeries, when soldiers were brought to the surgeon's table after a bloody battle, the situation worsened. Wounds from medieval battles were often fatal, simply due to the amount of blood lost or contamination from dirt and bacteria on the battlefield. During the Middle Ages, people frequently resorted to a vicious cycle. If they survived the initial operation, the biggest obstacle was the fight against infection. And when an infection couldn't be treated with medicine, what remained was isolation, while the patient slowly disintegrated, awaiting a death that in many cases was considered faster and less painful than post-surgical recovery itself. The naked truth of medieval surgery is that the lack of basic knowledge about the human body and hygiene conditions meant that most surgeries were a game of chance, a deadly lottery. Even if you had the best care or the most experienced hands, the risk of infection or complication never disappeared. There was no doubt that at times, surviving an operation was more a matter of miracle than medical skill. When you think of a medieval surgeon, what's the first image that comes to your mind? Perhaps a man in a cloak, with white gloves and a serious demeanor, guided by scientific knowledge and surgical precision. In reality, the medieval surgeon was very different from this modern stereotype. Instead of a highly trained professional, the medieval surgeon was most of the time a barber or a craftsman with minimal skills, relying much more on superstitious practices than on actual medical knowledge. In the Middle Ages, medicine was a practice divided into two theories, practiced by physicians generally well educated, but with little practical contact, and surgical practice performed by those known as barber surgeons. Barbers were the most common figures to perform surgical procedures, but their skills and medical knowledge were limited. These barber surgeons often learned their techniques through an apprenticeship system that most of the time didn't involve schools or formal studies. Instead, apprentices spent years observing and assisting in procedures performed by their masters, often having to learn by doing, whether with living patients or even cadavers, as the study of anatomy was considered dubious by the church of the time. In other words, practical experience came from a very uncertain and often lethal process. These surgeons were not doctors in the sense we understand today. They didn't study the underlying causes of diseases and disorders. Instead, they treated symptoms in a practical and brutal way. If you had an open fracture, a deep wound, or needed surgery, it was most likely a barber surgeon who would be called to help you. They did what they could with what they knew, and not always with success. These healthcare professionals were basically multitaskers, and their range of skills varied. While some were only capable of performing cuts or amputations, others might also handle dental issues, tooth extractions, for example, or even perform bloodletting to purify the body. Many barber surgeons also ventured into the field of spiritual healing, using religious rituals or sorcery to try to alleviate disease symptoms. Fear and superstition dominated much of the treatments. Furthermore, these professionals were also subject to the religious laws of the time, which viewed any type of study of the human body as an act of heresy. If surgeons tried to understand human anatomy more deeply, they could be accused of challenging the church's control over medical knowledge. Therefore, many surgeons found themselves forced to follow rudimentary and superstitious methods to heal or alleviate their patients, without daring to question what they were taught. Now think about the attitude a medieval surgeon needed to have towards their patients. They didn't have modern equipment, antiseptics, or detailed training systems. The medieval surgeon relied on practical skill and a good dose of luck for their surgery to be successful. The unbearable pain that patients faced was only part of the equation. The ability to work quickly and avoid complications was essential for success. If the surgery was poorly done, the chance of infection and death was extremely high. Even in a large medieval city, with access to more experienced surgeons, the level of knowledge about the human body and diseases was limited. There was no modern understanding of blood circulation, bacterial infections, or the importance of sterilization. What existed was a system of beliefs about the human body, where diseases were often seen as divine punishments or supernatural curses. This meant that even the most skilled surgeons had to deal with the fear of making mistakes and the spiritual guilt that hung over their heads. A simple error could result not only in the patient's death, but also in a crisis of faith that could ruin the surgeon's career. And yet, medieval medicine advanced much more than most imagine. Local healers, women with vast knowledge of herbs and natural remedies, and even alchemists began to influence the surgeons and doctors of the time. These individuals were often more experienced in treating diseases than traditional doctors themselves, with wisdom passed down through generations. Many medieval surgeons who dared to study the human body and healing techniques more deeply eventually became heroes like Paracelsus, who sought to unite traditional medicine with chemical knowledge. However, even these pioneers were subject to the fear and ignorance of their times, being frequently discredited or even persecuted. To understand the depth of the impact of these medieval surgeons, it is important to remember that scientific knowledge was still in its primitive stages. Physics, for example, was only just beginning to develop, and chemistry was far from being understood as we know it. For many, the alchemical and magical treatments they used were considered both an art and a science, and the line between what was accepted and what was heresy was extremely thin. Therefore, the skill of medieval surgeons was not just a matter of manual dexterity, but also of intuition, superstition, and a constant battle to survive in a world where medical ignorance was a constant enemy. Now imagine the scene. You're lying on a makeshift wooden table, perhaps with your hands and feet tied down to prevent any movement, while a sharp blade glints in the faint candlelight. There's no comfort, no tranquility, and worst of all, no anesthesia. Unlike today, where modern anesthesia allows us to escape the intense pain of a surgical procedure, the Middle Ages had no effective pain relief whatsoever. When a patient underwent medieval surgery, they knew they would face something far more difficult than the procedure itself: the pain. The pain in a medieval surgical procedure was immense, and the absence of anesthesia meant that patients had to face the terror of pure, raw agony. Surgeons used sharp knives and crude saws, often improvised instruments, with sweaty hands and frayed nerves. While the patient screamed, writhed, or even fainted from pain, the surgeon pressed on with what they had at hand, in an attempt to save the patient's life, unsure if the procedure would even be successful. And to heighten the anguish even further, the medieval surgeon had no way of predicting the level of pain their patient would endure during surgery. Since there were no medications or substances that effectively blocked pain, the most a patient might receive was a strong alcoholic drink, red wine, or even vinegar, to try to dull their senses a bit. However, what truly made a difference was the patient's willpower and their ability to withstand potentially unbearable pain. It's important to understand that the lack of anesthesia wasn't just a matter of scientific ignorance, but also of necessity. In an era where control over scientific advancements was minimal, and the Church often viewed medicine as something that should be in God's hands, there was no perceived need to invest in methods to alleviate human suffering. Pain relief was seen by many as something that could be contrary to divine laws, as suffering was interpreted as a form of atonement for sins. In some cases, such as simple surgeries or quick interventions, the surgeon would try to perform the procedure extremely rapidly to minimize the duration of suffering. For example, in an arm or leg amputation, the surgeon would use a crude saw, cutting quickly through muscles and bones with no regard for the patient's suffering. Upon completion of the procedure, the patient might simply be left to their fate, with very little post-operative care and an overwhelming risk of infection. But perhaps the most shocking case is that of trepanation surgery, where a hole was drilled in the skull to treat head injuries or even mental illnesses. The procedure was done without any anesthesia, and the patient could be fully conscious throughout the process. The surgeon used a rudimentary drill and heated irons to open the skull, all while the patient endured immense pain and the fear of their own impending death. The attempt to control pain, although there was no anesthesia, this doesn't mean there were no attempts to control suffering. During the Middle Ages, some substances were used in a rudimentary way to try to alleviate the patient's pain and distress. Among these, herbs and natural remedies stand out. Herbs like sage, daisies, and even chamomile were used by healers and apothecaries in attempts to sedate or relieve pain. However, the effect of these plants was very limited and often ineffective. Additionally, some cultures resorted to spiritual rituals or religious practices as a way to cope with pain. During operations, the patient often surrendered to prayer or mental control as a way to try to overcome unbearable pain. The most devout believed that, with divine help, they could face the pain without succumbing. Others resorted to amulets, incantations, or even witchcraft to protect themselves from pain or to ward off evil that had caused the illness or injury. Pain as an experience of purification. We cannot forget that, at that time, the concept of physical suffering and healing was closely linked to the idea of spiritual atonement. Pain was not just seen as an evil to be avoided, but as a way for the patient to purify their soul. Infections, extreme pain, and post-surgical complications were frequently viewed as divine punishment or a form of spiritual cleansing. This view shaped not only how surgery was performed, but also how the patient faced the experience. For many, medieval surgery was not a choice, but a necessity, and pain was part of the process of salvation. So, the lack of anesthesia in the Middle Ages was not limited to the absence of modern techniques, but reflected a lack of understanding of pain, the human body, and the true nature of suffering. Pain was not something to be treated urgently, but something to be accepted, often as part of a larger cycle of suffering, healing, and faith. Pain as a form of human resistance. Surprisingly, people at that time were not entirely powerless in the face of pain. Even without today's technologies, the will to live and human resilience were central elements in patients' experiences. Many patients survived medieval surgeries, not because of the surgeon's dexterity, but because of the incredible resilience of the human body and the willpower of people who faced pain with a courage that few people today could comprehend. Now, imagine you're in a small medieval village. A fever is burning through your body, and you don't know what's happening. What would you do? In a world where medicine was primitive and diseases were often interpreted as divine punishments or bodily imbalances, the most common answer would be bloodletting. Bloodletting was a universal treatment used to cure a wide range of ailments, from common fever to more serious diseases like the plague, and even psychological conditions. This practice of draining blood was not just a common medical treatment, but a widely accepted medical philosophy in the Middle Ages, largely based on the ancient theories of bodily humors that dominated medieval understanding of health. According to this theory, the human body was composed of 4 humors: blood, phlegm, yellow bile, and black bile. Health depended on the balance between these humors, and diseases occurred when they became imbalanced. To restore this balance, bloodletting was seen as the solution. Bloodletting was considered a miraculous cure for everything. If you had a headache, fever, or even emotional problems like melancholy, the immediate response would be blood must be drawn. Barber surgeons, the professionals responsible for this procedure, used sharp knives or special blades to make small cuts in the patient's veins, allowing blood to drain. Sometimes, they used leeches, small creatures that fed on blood, to perform the procedure. How was bloodletting performed? Bloodletting could be done in various ways. The most common procedure involved cutting a vein, usually in the arm, with the aim of allowing blood to flow freely. In more extreme cases, the surgeon would make cuts in more critical areas of the body, such as the neck or legs, if deemed necessary. The amount of blood withdrawn varied according to the perceived severity of the disease or the imbalance of the humors, but the procedure was not limited to this. For some conditions, especially the more severe ones, bloodletting was performed periodically, with the patient returning several times to have more blood drawn. The goal was to restore internal balance, according to the principles of ancient medical traditions. In some cases, leeches were used to drain blood more controllably and gradually. These small worms, known for their ability to suck blood, were applied directly to the skin. The patient would feel a slight pressure, but the process was painful, especially when the leeches moved to more sensitive areas of the body. The use of leeches became so popular that medieval cities even maintained leech farms, where the worms were bred and sold for this purpose. The impact of bloodletting on health. Although bloodletting was considered a miraculous cure at the time, in reality, it often worsened health conditions. Excessive blood withdrawal weakened the body, leaving it more vulnerable to infections and other complications. Often, the procedure left the patient so debilitated that they could not recover, contributing to an early death. But, worst of all, knowledge about blood circulation had not yet been developed. Medieval doctors did not understand that excessive blood removal could be fatal, as they believed blood was simply a substance in the body that needed to be controlled to maintain health. The ineffectiveness of bloodletting did not prevent it from being practiced for hundreds of years until scientific advancements, specifically the study of blood circulation, revealed the errors of this practice. However, the power of tradition and the authority of medieval medicine prevented many of these practices from being questioned. Faith in beliefs and the authority of doctors ultimately kept bloodletting as one of the most common healing practices, despite a lack of scientific evidence of its efficacy. Survival and the mystery of healing. Although bloodletting was one of the most dangerous practices in medieval medicine, it did not prevent some people from surviving infection or illness. Those who survived a botched bloodletting, or who were physically strong enough to resist the treatment, might experience an unexpected recovery. Often the healing did not come from the treatment itself, but from the human body's will to fight for survival. Medieval medicine did not understand how the body worked, and yet some people managed to recover from conditions that today would be treated very differently. What is truly fascinating about bloodletting is the mystery that surrounded healing. The relationship between healing and death was so tenuous that people often believed that the act of removing blood, even without scientific reason, was indeed restoring health. Even when there were no clear benefits, faith in medieval medicine made the treatment acceptable. Doctors and healers of the time firmly believed they were helping, and pain was seen as a process of spiritual healing. Bloodletting and its relationship with modern medicine. Although bloodletting was largely abandoned over time, it left a lasting mark on medicine. For centuries, doctors tried to better understand the function of blood in the human body, and it was only with the discovery of blood circulation in the 17th century by William Harvey that medicine began to move away from this practice. However, even today, bloodletting is remembered as one of the greatest historical blunders in medicine. Curiously, bloodletting has not disappeared completely. Some modern methods of blood removal, such as therapeutic blood donation or blood filtration, can be seen as descendants of the medieval practice, but now with a solid scientific basis that ensures their safety and efficacy. Amputations, a routine yet deadly procedure. Imagining the scene, you're on a medieval battlefield, or perhaps in a remote village, where life is simple and at the same time brutal. You've suffered a severe injury, perhaps an open fracture or a deep wound that won't heal. Your arm or leg is bleeding profusely, and you know that, without immediate intervention, infection will spread quickly, likely killing you. But the only option available to save your life is an amputation. No anesthesia, no modern equipment, no pain control systems. All you can do is hope the surgeon does the job as quickly as possible, and that luck is on your side. Amputation was a common and necessary procedure in the Middle Ages, especially for warriors returning from battles, where severe injuries like broken legs, severed arms, or contaminated wounds required drastic measures to save the patient's life. However, unlike today, medieval amputation was not performed under controlled conditions, with well-trained surgeons and clean environments. The process was extremely risky, painful, and often fatal, The reality of a medieval amputation. Limb amputation was a common, yet deadly, practice in the Middle Ages. The first thing to understand is that, unlike today, where amputation is performed with precision and state-of-the-art resources, medieval surgeons worked with rudimentary instruments. Knives, saws, axes, and even blacksmith's cleavers were the main instruments used, all unsterilized and often improvised. The patient, often passed out from pain or even awake in terror, was in a very vulnerable position. To make matters worse, the medieval surgeon had no knowledge of blood circulation or the importance of sterilizing instruments. This meant that, after the cut, the patient generally bled uncontrollably, without any adequate form of control. The risk of death from hemorrhage was extremely high. Such a mutilation required the surgeon to be quick, often with a rapid and brutal cut, without worrying about how much the patient was suffering. Time was critical. The longer it took, the greater the risk of the patient dying due to blood loss. However, the main concern was not just the cut itself, but the risk of infection. Without antibiotics, sterilization, or even a basic concept of hygiene, the instruments used for cutting were covered in dirt and bacteria. This meant that once the amputation was performed, the patient had little chance of surviving the infection that frequently set in. The chances of surviving amputation. If the patient was a warrior or a peasant, their chances of surviving the amputation depended heavily on their physical strength, their ability to resist pain, and their overall health. But most of the time, the lack of infection control and the absence of post-operative care made recovery very difficult. The first post-operative days were, in many cases, the biggest challenge. Without adequate care, bleeding could continue for days, and the patient, often in shock, would not be able to react in time. The use of dressings was rudimentary, if any existed at all, and many patients died shortly after surgery due to infection. Others were permanently debilitated and spent their lives living with permanent scars or mutilations, without the possibility of adequate treatment. In many cases, amputation was the last attempt to save a life, and it often happened in the open, with few or no medical resources available. The surgeon, or barber surgeon, who performed the procedure, often lacked the necessary experience and based their actions more on intuition and the superstitions of the time than on a real understanding of human anatomy. The psychological and physical impact. If they survived, the patient would likely face lasting physical and psychological consequences. The amputation of a limb meant not only the functional loss of a vital body part, but also a loss of identity and often difficulty in social adaptation. In medieval communities, being an amputee often meant being considered a burden, someone who could no longer work as before or participate in daily life with the same capacity. The psychological pain, aggravated by the lack of medical understanding of the nature of emotional suffering, was equally devastating. However, for the warriors of the time, amputation could be a necessary step for survival. If someone survived a great battle and could undergo an amputation, they would often be considered victorious for having been able to resist the process. These physical consequences, however, also carried a stigma, and over time, many amputation survivors ended up living on the social fringes, depending on public charity to survive. The evolution of amputation through the centuries. Although amputations in the Middle Ages were often deadly and traumatic, they were, paradoxically, one of the main drivers of surgical technique development. Over time, amputation practices were refined, with a greater understanding of blood circulation, and eventually, the introduction of anesthesia in the 19th century. Today, amputation is performed with surgical precision, modern equipment, and appropriate post-operative care. Anesthesia and antibiotics help transform what was once a death sentence into a possibility of survival, and rehabilitation techniques have allowed those who undergo amputations to regain their quality of life. But even so, looking back, we see that medieval amputation was a practice full of pain and suffering, and often the only option for survival for those at risk of death due to infections or severe injuries. The role of superstition. Medieval medicine, like many aspects of life in that era, was deeply intertwined with superstition and spiritual beliefs. Medical knowledge was still very rudimentary, and science was not well developed. As a result, people often resorted to the supernatural to justify diseases and their causes. Healers and barber surgeons not only used cutting tools but also employed magical rituals, spells, and even prayers to try to cure the patient, believing that physical treatment alone was not enough to restore someone's health. In the Middle Ages, religion and medicine often went hand in hand. For many, illness was seen as divine punishment or a sign of sin. Therefore, the first step in any treatment would be to seek spiritual intervention to heal the soul, often with the help of a priest or a religious figure who offered prayers or performed spiritual rituals before any medical procedure. If you were a medieval patient, your treatment would likely involve prayers or exorcisms to ward off demons, in addition to physical treatments with herbs and bloodletting. Medicine as a spiritual ritual. These healers and doctors believed that physical healing was intimately linked to spiritual healing. The concept that diseases could be caused by an imbalance of the body's humors still coexisted with the idea that spiritual guilt could be behind illnesses, especially those difficult to explain, such as mental illnesses or epidemics. In many cases, when an inexplicable disease arose, such as a mysterious fever, a patient might be treated with extensive religious rituals. The healer would invoke prayers to saints, or even use amulets and talismans, with the belief that these practices could ward off spiritual ills and heal the body. These practices formed the basis of folk medicine, and were used to combat everything from simple colds to more serious diseases like the Black Death. Rituals and sorcery as a complement to surgery. The relationship between folk medicine and superstition also affected more invasive procedures, such as surgery. When a patient underwent an amputation or other painful intervention, they received not only physical treatment, but also a series of magical rituals to aid healing and ward off evil spirits that might interfere with the recovery process. This was common in battles, where wounded soldiers were treated not only with scalpels and saws, but also with religious invocations and spiritual protections to increase their chances of surviving surgery and recovery. The idea that healing involved both body and spirit was so ingrained that many medieval surgeons and doctors used incense, magical herbs, and even potions as a spiritual reinforcement for their practices. It was not uncommon to see a healer use sage or basil to heal wounds while reciting prayers and incantations, invoking divine forces to aid in recovery. Superstition in the healing of mental illnesses. Superstition also played a significant role in medical practices related to mental health. Diseases like melancholy and epilepsy were often associated with demonic possession or a spiritual disturbance. Healers and medieval doctors treated these disorders with a mixture of spiritual rituals and physical treatments, believing that evil spirits could be expelled from the body through exorcisms or the application of amulets and sacred symbols. Mental healing also involved the perception that illness was not just a physical ailment, but also a spiritual affliction. Therefore, medieval doctors often prescribed prayers or even trips to sacred places as part of the treatment. Many patients with psychological problems, such as anxiety or depression, believed that the simple act of praying could alleviate symptoms. Superstition, plague, and epidemics. If we look at the Black Death and other epidemics that ravaged medieval Europe, we can see how superstition intertwined with the fear of the unknown. When inexplicable diseases spread, like cholera epidemics or the plague, people didn't know what caused them, so religious and supernatural explanations were the only alternatives. Many believed that diseases were a punishment from God, a form of divine retribution for the wickedness of the world. When the plague spread, medical responses were both physical and spiritual. People prayed, went on pilgrimages, and even flagellated themselves, trying to purify themselves and ward off the disease. But at the same time, they resorted to medicines and potions prepared by healers and alchemists. These potions, often made from mysterious herbs, had no scientifically proven effect but were used in the hope of curing or protecting against the plague. The implications of superstition in medieval medicine. Superstition not only hindered the scientific progress of the time, but also contributed to the ineffectiveness of treating diseases. While many of these superstitious practices had no scientific basis, they created an atmosphere of faith that could lead people to feel more confident in the treatment, or at least to conform to the lack of alternatives. While medieval healers and surgeons used rituals and superstitions, medicine as we know it today was still far from being discovered. However, the history of medieval medicine shows how, over time, this combination of science, superstition, and faith helped form the foundations of modern medicine, albeit with many distortions and deviations along the way. Surgical tools, primitive and brutal. Now imagine being in a dimly lit room, with only the faint glow of a candle illuminating the space. Anxiety takes over as you watch the surgeon approach with a tray of tools. To any modern person, would seem more appropriate for a blacksmith than a doctor. These rudimentary tools were what medieval surgeons used to perform procedures like amputations, trepanations, opening the skull, tooth extractions, and sutures. There were no precision scalpels or sterile instruments like we have today. Instead, what they had were crude knives, rusty saws, and metal needles that were often improvised and reused without any type of disinfection. Common tools, knife, saw, and axes. Medieval surgeons had a limited range of tools to deal with a wide variety of conditions. Scalpels, as we know them today, simply didn't exist. Knives were used for initial cuts into wounds and for making deeper incisions. For amputations, it was common to use blacksmith saws, frequently employed for cutting bones. The saw blade wasn't sharp like today's, but was robust, made for cutting without much concern for precision. These often neglected instruments posed a great risk of infection due to the lack of sterilization and the absence of antibiotics. In some circumstances, if the amputation was more complex, iron axes were used, especially on soldiers brought to field hospitals after battles. The speed with which these instruments were used reflected the urgent need for quick intervention, but also increased the risk of fatal errors. Needles and threads. The stitching process after surgery. If the patient survived the most painful part, the next step was to close the wound. And for this, medieval surgeons used crude metal needles, often made by blacksmiths. The needles were more similar to those used for stitching leather than for closing delicate incisions in human skin. Threads made from animal sinews, or in rarer cases, human hair, were used to suture the wounds. The suturing process was rudimentary and often imprecise. The surgeon, if lucky, managed to do an effective job, but the reality was that the wound remained vulnerable to infection due to lack of hygiene and the use of unsuitable materials. Even if the patient survived the initial operation, the healing process was often long and painful, with the risk of severe complications at every step. Lack of sterilization. The dangerous reality, one of the biggest flaws in medieval surgery, was the complete absence of instrument sterilization. At that time, there was no understanding of germs or the need to clean tools between procedures. Often, instruments used to treat an infection were the same ones used in a clean surgery, which further increased the chances of infection. This meant that, after each procedure, the patient was vulnerable to sepsis and other infectious diseases. Infected wounds were almost inevitable, and without the ability to treat these infections with antibiotics, death from gangrene or typhoid fever became a common tragedy for those who underwent surgery. The lack of adequate hygienic conditions in the operating room also meant that the environment itself was a vector for infection. There were no sterile gloves, masks, or clean clothing for surgeons, who often worked in clothes stained with blood from other patients or previous surgeries. The transmission of diseases through lack of hygiene was one of the biggest problems in medieval surgery. The tradition of barber surgeons and their tools. It's interesting to note that the practice of surgery in the Middle Ages was intimately linked to the barber profession. For a long time, barber surgeons were responsible not only for haircuts and shaves, but also for a range of surgical procedures, such as tooth extractions, amputations, and even bloodletting. Although the name barber suggested simple work, barber surgeons were in fact responsible for extremely complex and dangerous tasks. Barbers' instruments were often simple, like razors and knives, but also included scissors, saws, and other heavier objects for cutting hair, teeth, or even bones. A very characteristic item of this era was the red and white pole, which we now know as the symbol of barber shops. Historically, it represented both the function of surgery and bleeding. The red stripes were a reference to bloodletting and physical suffering. Magical tools, the survival of superstitious practices. In addition to cutting and suturing tools, many medieval surgeons still used magical or spiritual healing instruments. These included amulets, potions, bloodletting, and other religious artifacts that were considered fundamental for healing or alleviating the patient's pain. Often, the surgeon was not limited to physically acting on the wound, but also invoked protective spirits or used what they called the mystical power of herbs and sacred symbols. This use of rituals and mystical tools demonstrated medieval surgeons' limited understanding of the true nature of disease and surgery. For them, spiritual healing and physical healing were inseparable parts of the treatment process. The evolution of surgical tools. Although the rudimentary tools of the Middle Ages were unsophisticated and very risky for patients, they began to evolve over time. More precise instruments began to be developed from the 16th century, with the introduction of tools such as scalpels, syringes, and more refined suture needles. It was also at the end of the Middle Ages that the first anatomical physicians began to study the human body more scientifically, allowing for advancements in surgical practices. Over time, the practice of surgery moved away from rudimentary practices and closer to modern techniques. The evolution of surgical tools, coupled with an understanding of anatomy and infections, led medicine to a much safer and more effective level, especially with the introduction of sterilization and anesthesia techniques in the 19th century. The risks of infection. Imagine you've just undergone medieval surgery, perhaps an amputation, or even a trepanation. The surgeon has done their work, quick, imprecise, but with the best intentions. The pain you suffered during the operation was excruciating, but now, with the wound open, you hope for recovery. However, the greatest enemy is no longer pain or blood loss. The greatest enemy now is infection. In the Middle Ages, infections were the primary cause of death after surgery. The lack of sterilization and the ignorance of bacteria meant that post-surgical infection was inevitable in most cases. The human body was surrounded by an infinity of invisible microorganisms that could be transmitted through the air. The surgeon's hands, dirty clothes, or even unsterilized instruments used during the operation. To make matters worse, the concept of infection was still very primitive. Doctors and surgeons believed that diseases and infections were caused by an imbalance in the body's humors or by spiritual malice, as if the disease were a form of divine punishment or the result of malign external influences. The lack of understanding of infection. The medieval surgeon didn't know what caused an infection or how to treat it effectively. Without an understanding of microorganisms or how bacteria multiplied, the only available response was to rely on instinct and tradition. Sometimes, healers used medicinal herbs or potions to clean wounds, but these had limited efficacy. Other methods included bloodletting or cauterization, but none of these procedures treated the true cause of infections, which were most often the result of exposure to bacteria during surgery. However, the real danger came from post-operative care, when the patient without any form of adequate care ended up suffering septicemia, a generalized blood infection. Even small wounds without proper treatment turned into purulent wounds, which could result in devastating gangrene, where body tissues began to die, leading to death from blood poisoning. Gangrene. The silent death after surgery. Gangrene was one of the main causes of death after Middle Ages surgeries. When a wound was not treated properly, or when blood was not stopped correctly after an amputation, bacteria infected the tissues and blood. Since the concept of blood circulation was not yet understood, the infection process spread rapidly through the body, resulting in gangrene, a condition where dead tissues spread throughout the body, leading to blood poisoning, and eventually, multiple organ failure. Treatment for gangrene was very limited, and the only recourse surgeons had was additional amputation to try to cut off the infected parts, but often, this was useless once the infection had already spread. Gangrene was one of the most terrifying ways to die after medieval surgery. The patient would begin to feel intense pain, and the skin in the affected area would turn black, a clear sign that blood was no longer flowing properly. The foul smell of decomposing flesh made the suffering even more unbearable, and as there were no antibiotics or effective way to clear the infection, death came quickly after the onset of gangrene. Infection after amputation, a deadly challenge. Let's imagine you survived the amputation, you survived the cut and the bleeding. However, your struggle was far from over. Post-surgical infection would be a true battle for life. The risk of infection was amplified by unsanitary conditions, the absence of adequate medical care, and the lack of cleaning techniques. After amputation, the patient was left in an unsanitary environment, often with little or no wound cleaning. Wounds might be covered with dirty cloths, or even leaves or herbs, as an attempt to stop the bleeding, but this did nothing to protect the wound against bacteria or other infectious agents. When infection set in, the patient would begin to waste away, with high fever, chills, and an extreme feeling of weakness. The only available treatment was the extraction of more infected flesh, but even this procedure did not guarantee a cure, as systemic infection could spread rapidly, invading the bloodstream and leading to septicemia. The use of leeches or bloodletting to try to purify the blood of some imbalance was another unfounded effort that made recovery even more difficult. Superstition versus science, the conflict of explanations. During the Middle Ages, folk medicine and spiritual beliefs were so intertwined that often an infected patient received not only physical treatment, but also spiritual treatment. Sometimes, the sick person was taken to the local cleric or spiritual healer for prayers, believing that the infection was a consequence of a moral imbalance or divine punishment. This did nothing to cure the infection, but it could provide some psychological comfort. Medieval doctors and surgeons also saw infection as an imbalance of humors, or a kind of impurity of the body, and therefore tried to cleanse the body with bloodletting or even purges. These practices often worsened the patient's condition, as the weakening of the body did nothing to combat the actual infection at work. The loss of many lives. In summary, infection was one of the greatest challenges of medieval medicine. It was not just a post-surgical risk but a cause of death that affected anyone who suffered a cut, a fracture, or even a simple untreated wound. The ignorance of infection biology, the lack of sterilization techniques, and the absence of antibiotics made the fight against infections a losing battle for the vast majority of patients. And for those who survived surgery, the worst was yet to come. The nightmare of post-surgical infections. Trepanation. Drilling holes in the skull now. Imagine yourself in a truly gruesome scenario. You're in a dimly lit medieval room, with the sound of a blade cutting the air around your head. What you're about to face isn't a simple incision, but something far more terrifying and risky, a trepanation. A hole being drilled into your skull with rudimentary tools without any anesthesia, merely with the hope of curing or alleviating pain, mental illness, or even head injuries. This was the fate of many people in the Middle Ages who faced these extreme operations. Trepanation, or the drilling of the skull, is one of the most bizarre and dangerous practices in medieval medicine. This procedure involved perforating the skull with the aim of releasing evil spirits, curing mental illnesses, or relieving pressure from head injuries. What many didn't know at the time was that the human brain, being an extremely sensitive and complex structure, should not be touched in this way, and the probability of survival after such a procedure was minimal. Why drill into the skull? The idea behind trepanation was based on superstition and the humor theory of the time. According to the medieval view, many health problems, especially those related to the mind or behavior, were caused by demonic possession or spiritual imbalances. To treat these imbalances, doctors or healers resorted to trepanation, believing that drilling into the skull would help release evil spirits or restore the balance between the body's humors. Trepanation was also performed after head traumas where blood and fluid pressure accumulated in the brain due to an injury. The goal was to relieve this pressure and allow the patient to recover. Although this was the intention, the lack of knowledge about the human brain made the procedure risky, as it often resulted in fatal complications or irreversible damage to the patient. The trepanation process. The trepanation procedure involved the use of rudimentary tools such as iron drills or hand saws, with the surgeon perforating the patient's skull. The patient, without anesthesia, was frequently immobilized by assistants while the surgeon worked, and intense pain was inevitable. In some cases, the patient was merely soaked in alcohol or vinegar to try to alleviate the pain, but the sensation of having one's skull drilled into without any anesthesia was horrific. After the initial perforation, the technique involved removing a part of the skull or making a hole to allow the brain to be released from internal pressures. The operation was performed without any protection against infections, which drastically increased the risk of death after the procedure. And even if the patient survived the initial operation, the chances of brain infection and septicemia were extremely high. The spiritual and magical perception of trepanation. In the Middle Ages, many believed that trepanation was more than a medical technique. It was a spiritual intervention. Often, religious rituals were performed before, during, and after the operation, with prayers offered around the patient to ensure their spiritual healing. Healers and doctors, most of the time, also used amulets and sacred symbols to try to protect the patient and ward off evil spirits, believing that pain and infection could be controlled through the power of words and faith. This context of mysticism and faith surrounding the procedure was the basis for patients to undergo trepanation, trusting not only in the surgeon's skill, but also in divine protection. Spiritual beliefs about healing were so powerful that the extreme pain and risks of surgery seemed secondary to those who believed that healing would be both physical and spiritual. The surprising results of trepanation. The most surprising thing about trepanation is that in some cases, patients survived the operation and, paradoxically, reported feeling better after the procedure. For people of the time, this phenomenon was seen as a miraculous cure, proof that the procedure was indeed releasing spirits or restoring the body's internal balance. However, many patients would not survive the operation, and those who did often faced irreversible brain damage or permanent cognitive impairments. The positive results observed in cases of recovery were more related to the patient's willpower or resilience than to any real medical knowledge. Nevertheless, the fact that some patients temporarily recovered gave a false sense of the procedure's efficacy, and the practice was maintained for centuries. The legacy of trepanation. Trepanation is one of the most extravagant and risky practices in the history of medieval medicine, and although it was abandoned over time, it left a lasting mark on the development of modern medicine. Only in the 17th century, with advances in the understanding of human anatomy and the development of modern surgery, was trepanation effectively abandoned. However, the concept of brain surgery and the idea that interventions in the brain could be performed continued to influence the early advancements of neurosurgery in the 19th century. Curiously, trepanation has not completely disappeared. There are reports that in some traditional cultures, the practice was performed in isolation until the 20th century, with the belief that the procedure could cure diseases like epilepsy or mental problems. And more recently, modern neurosurgery has begun to approach methods that to some extent resemble the opening of the skull but based on scientific knowledge and extremely refined techniques. The legacy of trepanation and the limitations of medieval medicine. Trepanation is a clear example of the limitations of medieval medical knowledge. Although the practice was based on superstitions and unfounded theories, it also represented a human effort to deal with the unknown and try to save lives in the way that seemed possible at the time. The combination of scientific ignorance, desperation, and faith led people to attempt these extreme interventions, many of which resulted in avoidable tragedies. In modern medicine, we understand that the brain must be treated with extreme care, and surgical interventions in the brain are performed only when strictly necessary. with the help of advanced technology and scientific understanding of brain anatomy. The history of trepanation is a reminder of how the limitations of medical knowledge can drastically influence surgical practices and how superstitions can distort the intentions of healing. The surgeon's apprentice training through trial and error now. Imagine yourself at the beginning of your journey as an apprentice to a medieval surgeon. You're not in a medical school with brightly lit rooms and modern simulators. You're in a dim environment, probably in a barber surgeon's workshop. Here, learning is brutal and immediate, with real patients and real procedures. Your training doesn't come from books or formal classes, but from hours of observation, followed by trial and error, where errors can be fatal. The surgeon's apprentice in the Middle Ages didn't have the luxury of a structured curriculum or an academic program. Instead, they learned by doing, under the supervision of a master, but often without the guarantee of success or safety. The practice of surgery was a gradual process, where you started as an assistant and gradually took on more responsibilities. However, unlike modern doctors, the line between safe teaching and what could result in fatal errors was very thin. Practical learning with unpredictable results. As an apprentice, you were a keen observer during the first operations, watching your master, usually a barber surgeon, as they cut, sawed, and sutured patients. But the reality of training involved more than just watching. You are often required to participate. Bloodletting, tooth extractions, and even amputations were part of your training. There were no simulation trainings or controlled experiments. If a patient didn't survive your first attempt at suturing, you would learn from it, but the cost would be high. The experience of being a surgeon's apprentice in the Middle Ages was, most of the time, in the heat of the moment. There was no room for small mistakes, as a simple slip could cause a patient's death. However, this training system provided direct learning, which over time led some apprentices to become skilled, and in some cases, renowned masters, but always with the risk of catastrophic failures. The lack of formal training. The central problem was that training didn't follow a uniform standard. Some apprentices were luckier than others, depending on their master's experience and skill. What the master surgeon knew or didn't know was what you would learn, and if they had limited knowledge, the same would apply to you. Often the approach was more empirical than scientific, and much of what the apprentice learned was based on superstitions, magical rituals, and rudimentary treatments, with little to no explanation of how or why the techniques worked. As you progressed as an apprentice, you transitioned from bloodletting assistant to amputation performer, but always without full confidence that you could handle every situation that arose. Errors were fatal, and masters were severe, often having little time or patience to teach effectively. The lack of a formal and scientific education hindered learning, and practice and chance often determined the effectiveness of your training. Exposure to the risk of death and deformities. What's even scarier about this learning process is that apprentices were frequently exposed to extreme situations and had to deal with fatal errors. If the surgeon made a mistake, the apprentice had to correct it, or even take responsibility for a botched procedure. Many apprentices ended up with permanent disabilities due to accidents during operations, this being part of the reality of working in an environment without adequate training and under conditions of great stress. One can imagine that as a surgeon's apprentice, pain and fear would always be present. The learning process meant not only witnessing the pain of others, but also experiencing the pain of guilt and failure. The risk of harming a patient during your first operation, or making a judgment error, was a constant burden. The transition to surgeon, risk and reward. Over time, the apprentice became a surgeon, taking on more responsibilities and beginning to perform surgeries with a certain autonomy. But this autonomy was fragile. The medieval surgeons still relied on their practical experience and continuous observation to refine their skills. Practice offered no guarantees, and even those who became renowned surgeons had to deal with the risks of operating without a solid scientific basis. In an era when advanced anatomical knowledge and scientific understanding of the human body were practically non-existent, surgeons had to rely primarily on their empirically acquired skills. Time and experience were the only ways to become more skilled, but this did not always guarantee an error-free practice. The great advantage of more experienced medieval surgeons was the fact that over many years they became faster and more effective in their techniques. But this experience also came with a high cost. Surgeons spent their lives living on the edge of risk, between the life and death of their patients. There was no room for hesitation or doubt. The operation had to be performed quickly and precisely, but this also meant that the line between success and failure was very thin. The uncertainty of the path to perfection, surgical perfection, did not exist in the Middle Ages. Surgeons were not specialists, but artisans of human pain and suffering. The path from apprentice to master was long, and often, medieval surgeons spent their entire lives dealing with personal fears and the consequences of a fatal error. The fact that surgeons and their apprentices were constantly facing such great challenges, with each operation being an experiment in life or death, made the profession dangerous and often traumatizing. The evolution of medical education. Eventually, medical training began to become more structured, and surgeons started attending medical schools and universities during the Renaissance. The concept of scientific anatomy began to be better understood, and teaching techniques evolved. But for medieval surgeon apprentices, their journeys were permeated by doubts, fatal errors, and a lack of resources. For many of them, learning was not just a path of professional growth, but a constant battle for the survival of their patients and their own careers. No clean sheets, no sterile tools. Now imagine the scene. You're about to undergo medieval surgery, and the room where you'll be operated on is far from a sterile environment. There are no white walls, no soft light from fluorescent lamps. Instead, you're in a dimly lit operating room, barely illuminated by a few flickering candles. The smell of blood and dirt hangs in the air. The surgeon begins to prepare their tools, but you soon realize that the set of instruments before you hasn't been properly cleaned. No sterilization. No surgical masks or gloves. All you see are iron knives and saws, some with traces of blood from previous operations. This is the environment in which you, the patient, must trust to survive a potentially deadly procedure. The lack of sterilization in medieval medicine. In the Middle Ages, surgeons and doctors had no concept of microorganisms or infection. Hygiene, as we understand it today, simply did not exist. Surgical tools were used repeatedly, without any type of disinfection or proper cleaning. After each operation, surgeons superficially cleaned their tools, often with dirty rags or even with vinegar or salt. But none of this was enough to remove the bacteria and pathogenic agents that accumulated on the blades, saws, and needles. This lack of cleanliness of tools and the surgical environment was one of the biggest causes of infections and post-surgical death. The concept of sterilization had not yet been developed, and contagious diseases were understood only superficially, or often not understood at all. Infection was not seen as something caused by bacteria, but as a result of spiritual imbalances or external evils. The dirty and unsanitary environment of surgeries. In addition to the lack of sterilization of tools, the environment itself where surgeries were performed was also filthy. Often, operations took place in poorly ventilated rooms, with little light and very cramped spaces, where the patient was exposed to various infectious agents. The floor was covered with dust and dirt, and the surgeon's or patient's clothes were often not changed between procedures. In medieval hospitals, the lack of adequate facilities to clean and sterilize equipment further exacerbated the situation. Operating beds were makeshift, often made of wood or other non-hygienic materials. Bedding was also rarely cleaned effectively, creating an environment conducive to the spread of infections. The problem of improperly treated wounds. After surgery, the patient received no modern post-operative care. Wounds were left to heal in a crude and precarious manner. The idea of sterile dressings simply did not exist. In many cases, wounds were covered with dirty cloth, plants, or even herbal potions, but none of this prevented infections. The patient, having survived the initial surgery, often died days later from complications caused by infections. Bleeding after the operation was also not effectively controlled. When a patient lost a lot of blood during surgery, they were left in a state of great vulnerability, as anemia was a constant concern, and the patient had no access to adequate care. The body weakened, making it harder to resist a subsequent infection. Medieval healthcare systems, a chaotic reality. Most of the time, operating rooms were not in hospitals as we imagine them today. Often, operations took place in the patient's home, where a barber surgeon improvised an operating room, according to the available resources. If surgery happened in a hospital, it would be an unsanitary place, where hygiene conditions were very precarious. Hospital beds were often shared among patients with open wounds, and the risk of transmitting contagious diseases was extremely high. Some medieval hospitals were controlled by religious orders, and often, the main function of these hospitals was to care for the spiritually ill, more than the physically ill. This meant that in many cases, concerns about hygiene or adequate scientific treatment were secondary. Religious faith and spiritual rituals were considered more important than scientific health practices. The Church's influence on medieval medicine. The Catholic Church, which dominated much of Europe in the Middle Ages, also had a profound impact on how medicine was practiced. The Church saw spiritual healing as the primary form of treatment, and physical treatment was often relegated to a secondary role. Doctors and surgeons were frequently limited by religious censorship, which prevented them from studying human anatomy and medical sciences more deeply. Often, the focus of medical treatments in the Middle Ages was more on religious rituals than on scientific procedures. Spiritual healing through prayers and religious sacrifices was an important part of the medical treatment of the time. This meant that practical and scientific care for diseases was very limited, and patients were often forced to rely more on their faith than on any real medical advancement. The evolution of medical practice and hygiene. The lack of hygiene in the Middle Ages resulted in a large number of deaths that could have been avoided with modern care. However, scientific advances in the 19th century, particularly with the introduction of surgical instrument sterilization and the development of antiseptics by Joseph Lister, marked a turning point. The discovery of pathogenic microorganisms and the concept of cross-contamination paved the way for a revolution in wound treatment and surgery. Although the Middle Ages was a time of great medical suffering, it also provided the foundation for the advances that would occur in subsequent centuries. The cleaning and sterilization of surgical instruments, which are now standard in all operations, can be seen as the result of centuries of trial and error and of practices that, although primitively effective, were largely based on superstitions and scientific limitations. Surviving without modern medicine. Imagine yourself in an era where there's no access to antibiotics, vaccines, effective treatments for diseases, or even basic knowledge of how germs affect the body. Modern medicine, with all its scientific wonders, is still centuries in the future. In the Middle Ages, surviving a simple cold, a wound, or even a serious accident was a true challenge, and the lack of adequate medical resources made every day a real fight for survival. Without effective treatments, life in the Middle Ages was dominated by uncertainty and the constant fear of diseases, infections, and accidents. What people knew about the human body was limited, and what was considered healing was often more related to faith and superstition than to any scientific understanding. Common diseases and people's despair. Many of the most common diseases of the time were practically incurable. A simple cold could turn into a severe infection, like pneumonia, which killed millions of people. The Black Death, which decimated up to a third of Europe's population in the 14th century, was a terrifying disease that spread rapidly and killed within days, without doctors having any idea how to combat it. Diagnosis was also a murky field. If you were sick, there were no modern tests to identify what was wrong. Medieval doctors knew nothing about bacteria or viruses. Diseases were frequently attributed to spiritual influences, such as demonic possessions or imbalances in the body's humors. As a result, treatments were often ineffective or even dangerous, such as the practice of bloodletting or the use of potions with dangerous ingredients. Surviving accidents and medieval surgery. If you were someone who survived a serious accident or injury, the chances of recovery were very slim. Without the possibility of anesthesia or precise surgery, an open fracture or an amputation meant your life was on the line. There was no adequate post-operative care, and infections were almost inevitable. Without antibiotics, any wound could become fatal, causing gangrene and eventually death by septicemia. If you were a warrior returning from a bloody battle with fractured or wounded limbs, your fate would depend almost entirely on your luck. If you were fortunate enough to be treated by an experienced surgeon, recovery was possible, but infection and bleeding were always a threat. Even if the surgery was performed correctly, the chance of survival was minimal if you developed an infection in the following days. The fight against plague and other epidemics. When the Black Death reached Europe in the 14th century, it destroyed entire cities, leaving a trail of death and despair. Without a basic understanding of how the disease spread or how to prevent it, the medieval population was unable to cope with the pandemic. Authorities had no medicines to cure or slow the disease, and almost all attempts at treatment were ineffective. The plague, in the medieval view, was often interpreted as a divine punishment, which led people to resort to religious practices to seek relief, such as praying or performing penance. But without modern medicine to contain the spread, fear and panic spread as much as the disease itself. For the masses, the simple act of coughing or sneezing could mean imminent death, and the isolation of cities and villages often became a desperate measure of protection. The impact of natural practices and folk remedies. Without effective scientific medicine, people often resorted to natural remedies, medicinal herbs, and even spiritual rituals to treat diseases. While some of these practices might have had some effect, such as using sage to alleviate sore throats or applying licorice to treat coughs, many were ineffective or even dangerous. Healers and apothecaries lacked the knowledge to differentiate effective treatments from harmful ones, and dosage errors frequently resulted in poisoning or other fatal complications. Often, remedies were made from dangerous substances, such as mercury, lead, or arsenic, which, although offering some temporary relief, caused long-term damage. The indiscriminate use of bloodletting or purges also weakened patients, leaving them more vulnerable to other diseases. Life without medical technology, a continuous struggle. The lack of access to any kind of modern medical technology transformed life in the Middle Ages into a true struggle for survival. Even something as simple as a cold or a toothache could be a death sentence if not treated properly. Life in many respects was constantly at risk, and the limits of medieval medicine were constantly tested by new and unexpected diseases. However, as grim as the scenario of medieval medicine was, some people managed to survive, not only disease but also brutal procedures, such as surgeries without anesthesia and dangerous treatments, because the human body is incredibly resilient. Many of these people survived not due to the quality of treatment, but to the strength of human nature and the body's resistance to pain and disease. Hope and future advancements. Despite all the difficulties and dangers faced by people in the Middle Ages, the advanced progress of modern medicine slowly began to form. The development of vaccines, the discovery of antibiotics, and the scientific understanding of the human body began to transform the treatment of diseases and injuries. What was once a constant struggle for survival became, over time, a more balanced battle, with more chances of victory. The Middle Ages, with all its medical limitations, represented a fundamental stage in the evolution of medicine. The healers, apothecaries, and surgeons of that era helped lay the foundations for what would be a revolution in the treatment of diseases and injuries in the following centuries. Human resilience and the desire to survive disease and pain were the true driving forces behind a medicine that, although primitive, took the first steps toward a future where diseases could be prevented and cured. The legacy of medieval surgery, Although medieval medicine was brutal, primitive, and often ineffective, it left a legacy that would profoundly influence the development of modern medicine. While many of the practices of the Middle Ages, such as trepanation, bloodletting, and surgeries without anesthesia, may seem absurd or even cruel by today's standards, they were the seeds of advancements that completely transformed the way we treat diseases and injuries. The pioneers of medieval surgery during the Middle Ages, surgeons and healers were, in many ways, pioneers, even without the scientific understanding we have today. Some surgeons, like Rhazes and Avicenna, are still remembered for their contributions to medieval medicine. Rhazes, a Persian physician, was one of the first to write about the importance of hygiene and the relationship between infection and healing. Although his observations were rudimentary, they paved the way for a deeper understanding of disease and healing. Other medieval surgeons, like Paracelsus, began to challenge traditional ideas and apply key alchemical discoveries to the treatment of diseases. Paracelsus believed that treatment should be more individualized and scientifically based, proposing the use of chemical substances and minerals instead of simple herbal remedies. Despite his persecution by the Church, his ideas later helped transform modern medicine. Advanced anatomical knowledge. Despite the limitations of medieval medicine, this era of scientific ignorance was also a time of great discoveries. Medieval anatomists began dissecting bodies, which, although frowned upon by the Church, allowed for a deeper understanding of human anatomy. One of the greatest advances came with the work of physicians like Mondino de Luzi and Vesalius, who in the 16th century redrew anatomical diagrams based on direct observations and began to challenge many erroneous beliefs about the human body. These detailed anatomical discoveries contributed to the first modern surgeries, where surgeons not only cut and amputated without understanding the body's internal workings, but began to understand the location of organs and blood flow based on more scientific studies. Advancements in surgery during the Renaissance. The Renaissance, which followed the Middle Ages, was a time of great advancements in science and medicine, largely thanks to the work of doctors and surgeons who learned from the mistakes and failures of the past. Andreas Vesalius, one of the most famous anatomists of the Renaissance, revolutionized the field of anatomy by publishing his book De Humani Corporis Fabrica, which contained detailed drawings based on human body dissections, allowing for a clearer understanding of bodily structure. Another major advancement was the work of Ambroise Paré, a French surgeon who was responsible for many technical innovations in military surgery. Paré challenged ancient practices like bloodletting and instead used plant-based antibiotic potions and ointments to treat war wounds. He also pioneered the use of prostheses and bandages to treat wounded soldiers, as well as developing new suturing techniques that were much more effective and safer than the old ones. The development of modern surgery. The true revolution in surgery began with William Harvey's discovery of blood circulation, who in the 17th century was the first to demonstrate that blood circulates throughout the body through a closed system of blood vessels. This discovery was fundamental for advancements in cardiovascular surgery and other areas that require a deep understanding of the human body's functioning. In the 19th century, the discovery of anesthesia revolutionized the field of surgery. Before anesthesia, patients had to endure unbearable pain during surgeries, which in itself was a significant cause of death. The introduction of substances like ether and chloroform allowed surgeons to perform more complex operations without the immediate risk of death from shock or excessive pain. With the development of sterilization by Joseph Lister in the late 19th century and the understanding of bacterial infections, modern surgery took a huge step towards safety. The introduction of sterilization techniques for tools, surgical environments, and surgeons' hands helped dramatically reduce infection and death rates in surgeries. Legacy and contributions of medieval medicine to the modern world. Although medieval medicine was often ineffective, it was a fundamental part of the development of modern medicine. The rudimentary practices and mistakes made by medieval surgeons contributed to subsequent scientific advancements, as these errors were studied and corrected in later generations. The development of modern surgery, with sterilized instruments, anesthesia, and precise techniques, owes much to the work of medieval doctors, even if the latter did not fully understand what they were doing. Medieval medicine, with all its flaws and limitations, can be seen as the bridge between the primitive and superstitious world and the modern and scientific world of medicine. Many medieval surgeons and healers were pioneers in their fields, trying to find solutions to health problems with the limited tools and knowledge they had. Undoubtedly, their legacy was fundamental to the achievements of modern medicine, and many of the advancements and discoveries that came later owe something to these early efforts to heal and understand the human body. Respect for the pioneers of medicine. While many practices of medieval medicine are viewed as barbaric and ineffective, we must remember that in the context of their time, these doctors and surgeons were trying to do their best with the limited knowledge and resources at their disposal. The first attempts at dissection, the first steps in human anatomy, and the attempts to understand the causes of diseases laid the groundwork for the scientific revolutions that would follow. Today, modern medicine owes much of its effectiveness to the discoveries and experiments made in the Middle Ages, however brutal they may have been. They in some way planted the seeds of medical science and paved the way for the future. The legacy of medieval medicine is therefore impressive, and in many aspects, recognized in the evolution of disease treatment and surgery as we know it today. Now finally, we arrive at the fundamental question: would you have survived medieval surgery? A simple question, yet full of profound implications. The scenario in the Middle Ages was extremely risky for any patient needing surgical intervention. There were none of the advancements we have today in terms of anesthesia, antibiotics, sterilization, or post-operative care. Each operation was a gamble, where success depended not only on the surgeon's skill, but also on the resilience of the human body and the luck the patient had in escaping fatal infections and complications. The lack of anesthesia, intense pain. If you had to undergo surgery in the Middle Ages, pain would be your constant companion. Nothing like modern anesthetics, such as morphine or ether, existed. What you would likely receive would be alcohol or perhaps a vinegar-soaked cloth to try to ease the pain. None of this would be enough to block the excruciating agony of an amputation or a trepanation drilling into the skull. You would be fully conscious during the procedure, with the surgeon cutting, sawing, and suturing your body without any adequate pain relief. Your chance of surviving the surgery would depend heavily on your pain tolerance, but also on your ability to withstand the physical shock caused by the severity of the operation. The danger of infection. Even if you endured the pain and the surgery was performed successfully, the greatest risk you would face would be infection. Without antibiotics, any open wound or any cut exposed to the air was susceptible to invasion by bacteria and germs. The concept of sterilization simply didn't exist, and the tools used by surgeons were often inappropriate, frequently poorly cleaned or reused from previous operations. If you recovered from the pain and shock of the operation, you would probably still have to face the risk of gangrene, a bacterial infection that would rapidly take over the body. The chances of survival after an infection were minimal. Without modern antibiotics to combat the infection, many victims of medieval surgeries succumbed to infections within a few days. The fight against bleeding. After any type of invasive surgery, bleeding would be a major problem. Since medieval surgeons had no concept of how the human body dealt with blood flow or blood pressure, bleeding after an amputation or any severe cut could be uncontrolled. Although some attempts at hemorrhage control, such as the use of cauterization, burning the wound with a hot iron, were made, the effectiveness of these methods was very limited. Hemorrhagic shock could be fatal in a matter of hours, especially if the patient was debilitated by a pre-existing illness or a significant wound. Even if you survived the initial procedure, the risk of dying from blood loss or infection was still extremely high. The resilience of the human body. With all that said, it's surprising that some patients actually survived these brutal operations. Human resilience is without a doubt one of the greatest mysteries. The human body is incredibly strong and capable of fighting against many challenges, even when medical care is practically non-existent. Those who survived the intense pain, infections, bleeding, and physical shock of medieval surgery did so largely due to physical fortitude and the will to live. Furthermore, some patients who underwent medieval surgery might have been very young or had a strong immune system that would help fight infections, while others, out of desperation, may have recovered simply due to favorable circumstances. Perhaps the surgeon was more skilled than average, or perhaps the surgery was performed at a time when the infection had not yet had time to spread. We cannot underestimate the impact of luck in these cases. Factors influencing survival: patients' age and health. Young people and those in good physical health generally had a better chance of surviving surgery, as their bodies were more capable of handling the trauma. Older patients or those with pre-existing conditions had less chance. Type of surgery. Simple procedures, such as tooth extractions or bloodletting, might have had higher survival rates than invasive procedures like amputations or trepanation. Surgeon's skill. The success of a medieval surgery depended, in large part, on the surgeon's experience. Many medieval surgeons were barber surgeons with little formal training, and their skill varied greatly. Some might be very skilled, while others would make fatal errors. Environmental conditions. The medieval operating room was far from a clean or controlled environment. The likelihood of infection was very high if the operation was performed in a dirty and disorganized space. The cleanliness of the tools was also not guaranteed. The fate of the medieval patient. You could have been one of the exceptions, someone who managed to survive the primitive conditions of medieval surgery, or you could have been one of the many victims of the medical system of the time, a tragic statistic in the constant struggle for survival. There were no guarantees. What is known is that, with all its flaws and limitations, medieval medicine was an important stage in the development of medical science, which would later allow surgeries to be performed with more precision, safety, and efficacy. Therefore, the question remains, would you have survived? The answer would depend on many factors, such as luck, general health, and of course the specific moment in time you lived. But one thing is certain: life in the Middle Ages was a constant challenge for survival, and medicine, though rudimentary, did its best to give each patient a chance, however minimal,